If I may ask, what's your stress level like right now? If you had to rate it on a scale of 1, no stress at all, or 10, close to the verge of a mental breakdown, where would you put your stress at? Would you say it's low, medium, high? Most of us has some sort of stressor in their life, rather it be inflation, the cost of living, work stress, worries about the future, gas prices. We all have some sort of stressors that keep our jaw clenched. Now, here is where the meat and potatoes of this video comes from. The real portion that we're trying to get into. How do you find relief from life stresses? To go on a vacation? Nice spa day? Massage? Drink 2 or 3 bottles of alcohol? Well, all of those are legal options. But what about illegal options? Now, with all those legal ways to unwind, why would anyone choose an illegal option with its consequences attached? Is it worth it? Have you ever wondered how exactly addiction happens? And more importantly, for healthcare providers, how does the human body process drugs and alcohol? Why do we see different vital signs, patient presentations, signs and symptoms with each substance abuse or use? All of those are such great questions that are a big blue vast sea, and we're going to dive in pretty deep. Thanks for tuning in. So, speaking of deep dive, we're going to dive deep into the substance marijuana in this particular video. And by the end of this video, or at least volume 1 of this video, a provider should be able to define and differentiate drugs versus medications, explain the commonly used terms uppers and downers, discuss the function of the DEA and the considerations regarding drug scheduling, describe various street names and consumption forms of marijuana, explain how THC affects the central nervous system and how this creates a high, describe anandamine's role in creating a high, expound on the dangers of cannabinoid hyperemesis syndrome, list common reasons for emergency room visits in conjunction with marijuana use, annotate treatments in conjunction with marijuana side effects, and finally, explain how synthetic marijuana is produced in and with what common chemicals, and describe the dangers of synthetic marijuana consumptions and the characteristics of a bad batch, and how marijuana has infiltrated correctional facilities. It's a lot to dive into, isn't it? But a good place to start is by clearly defining drugs. What exactly are drugs? Everyone has terms. Nugs, not drugs, just say no, the DARE program. Everyone, even little kids, know something about drugs. In the days of social media, education can come from just about anywhere, good sources and bad. Music, Google, and unfortunately, personal experience. Now, there's drugs and there's medicines, and most everyone knows something about medicine. Are those two things the same? What's the difference between a drug and a medicine? Let's go through some examples. Heroin is a commonly referred to drug, but Lasix is a drug too, right? So what do those two things have in common? Well, the term drug can be used interchangeably, but the word medicine Can't. When a drug deal happens, does someone say, hey, can I get the, medicine? Wink. No, no one's looking for my Lanta because the connotation tends to change. And usually the effects that come from medicine are favorable. Since the main purpose or the main goal of medicine is what? Treating disease or pathologies. So some common medications, aspirin, fluoride, vaccines, antibiotics, those would all fall under the category of medicines. They're good. They're there to help. Now, another characteristics of medicine is that most are prescribed by a doctor, some sort of healthcare professional who can regulate a person's dose. Now, obviously, this is for a lot of reasons. Safety, but emphasizing again to ensure the goal of treatment is met. Because if treatment isn't met, then what can happen? Well, a medication gets what we call titrated, meaning adjusted accordingly to a patient's need to ensure a suspected or proposed outcome. And that highlights again the necessity of medication. This outcome is beneficial and in many cases, life-saving. Basically, the safe road. Also important to consider is these medicines are usually monitored by, again, a healthcare professional or a pharmacy, because a term, polypharmacy, is known to happen pretty frequently, which is multiple medications. So unfortunately, what can happen if there's multiple medicines on board, then that means someone should monitor those medications to ensure that adverse actions or effects don't happen. So contrast everything that we've just said about medicine with alcohol or nicotine or caffeine. Now, all of those are also considered drugs. Why? Well, because they are typically not prescribed in a regulated dose or monitored by a healthcare professional. We all have access to any one of these. Oftentimes, they're so easy to get to, and the benefits to these items are not life-saving and unfortunately not essential to the human body, no matter how much we feel that we need the cup of coffee. But there is one ingredient here that we should consider: caffeine. Now, caffeine is indeed found in some medications. If, like me, you have migraines, then maybe you've heard of a medication named Fioricet, Bupital. Now, Fioricet is the brand name for a mixture of 3 ingredients: acetaminophen, Bupital, like we said, and caffeine. And these ingredients work well together because caffeine, in this case, does an intended purpose. It works as a central nervous system stimulant, which relaxes muscle contractions and blood vessels and improves blood flow. Now, in this case, caffeine is used as a medicine. And the reason for that is to treat a specific pathology. And in the end, the ultimate goal: improve the patient's condition. And again, can't say it enough, this is done under a physician or pharmacist regulation. And this is why drugs have a different connotation, because drugs can be used for pharmaceutical or recreational purposes. You don't hear anyone attempting to gain a high from a vaccine or an antibiotic. While those are medical treatments, we don't automatically think of them as drugs, do we? So let's talk about addictive properties. Both medicines and drugs can become addictive. And we're going to talk about this in detail, but especially when we talk about the regulation of this by a group known as the DEA. But another category of addictive substances are recreational drugs. Now, recreational drugs are drugs that are used without medical supervision. When you think of the term recreation, what comes to your mind? Sports, camping, gathering with friends, doing something enjoyable. And usually the goal of any or all of those activities is to relax and refresh, unwind. Well, drugs that are used for relaxation, a good time, and unwind all fall into the realm of recreational drugs. There may be medical benefits there, but the ultimate goal is that relaxation and the escape. And unfortunately, there's no regulation because, unfortunately, some recreational drugs are obtained illegally, which presents a whole other problem. And we're going to talk about that extensively. So, how do we organize different types of drugs and medications? Have you noticed organization follows patterns? Stripes match stripes and dots match dots. Rather it be an organization of clothes or a closet, drugs, there's a basic principle. If you've heard of a name, Marie Kondo, she has coined a method of organization that has sold to millions of people. And it's based off a very simple principle. For simplicity, belongings can be organized by means of category of location. Simple principle, but it works. And that principle of organization carries over to the way that we classify drugs. We classify drugs by what we know as mechanism of action. Mechanism of action is a physiological effect, and we can also categorize drugs by their chemical structure. And those different labels, or if you can picture a file folder with all those tabs, we would call each of those tabs or manila file folders a class. And these classes, they're so important because they help us to understand exactly what a drug or medication does when it is in the human body. Think about some common drug classes. Beta blockers, calcium channel blockers. Now, we get a clue from those classes into a drug's function. Let's discuss a very important part of this organizational method, and it's the regulation. Now, the regulation is done by the DEA, which stands for Drug Enforcement Agency. Now, it's true. All of the resources and people of the DEA are dedicated to the mission of enforcing controlled substance laws. This is the main reason that they exist. And the common understanding that we all know, investigating criminals and gangs, illegal drug trafficking, it is the core of what they do. But for medical professionals, and especially when we speak about some of these addictive substances, there's something else that the regulation by the DEA ensures, which is the manufacturing and distributing of controlled pharmaceuticals. And we do that by something known as scheduled or prescription drugs. And those scheduled drugs are listed via chemicals. And here's where it becomes important. Because when people organize, sometimes you use a different bin or shelf of some sort. And that's basically the function of what the DEA does. And so we call those different bins or different file folders, however your brain wants to think of it, something known as scheduling. And we're not talking scheduling a calendar, it's scheduling drugs. And when we say scheduling, we talk about Drugs, substances, chemicals that are used to make drugs. And we take all of those and we classify them into 5 distinct categories or schedules. And this depends on the drug's acceptable medical use. And here's something very important to remember. This is a big one here. It also depends on the drug abuse or dependency potential. Now, that abuse rate is a determining factor in the scheduling of drugs. And quite frankly, it regulates the way most healthcare providers provide care. For example, Schedule 1 drugs have a high potential for abuse and the potential to create severe psychological and or physical dependence. As the drug schedule changes, Schedule 2, 3, etc., so does the abuse potential. So we talked about Schedule 1. Now Schedule 5 drugs represent the least potential for abuse. Another way that healthcare providers classify drugs is by 2 very common terms, uppers and downers. Drugs can be classified how they affect the mind and how they affect the body. For example, drugs that tend to make a user feel active, energetic, run from a bear. And there are others that make someone feel calm and relaxed, the feed and breed, right? To be actually technical, there's really 4 main classifications actually. Uppers, downers, hallucinogens, and inhalants. Drugs can be grouped into 4 of those categories. And these type of categories refer to how drugs impact the mind and the body. And here's a key point, in particular, the central nervous system. In short, downers are depressants and uppers are stimulants. The increase of energy, concentration, alertness. And in short, uppers are believed to provide a rush. So we have increased productivity, performance, and it produces a high of pleasure and excitement. And in the long term, they usually are incredibly addictive and have a high potential for abuse. Let's start some examples of uppers. Amphetamine, methamphetamine, cocaine, ecstasy. Now, one drug on this list in particular, ecstasy, according to the DEA, is a Schedule 1 drug or substance or chemical. That means that it has no currently accepted medical use and also has a high potential for abuse. That's the point. LSD, methamphetamine, ecstasy, those all fall into those categories of the uppers, the rush. Now let's discuss downers. Downers affect the central nervous system by just what it sounds like, a depressant. The functioning of the central nervous system slows and feelings of relaxation occur, tiredness, oftentimes when one feels that they need an escape. This is the type of drug that could be preferred. And many of these drugs are prescribed for symptoms of insomnia, mental illness, but are very commonly abused because they often create the feelings of euphoria. Depressants are among some of the most highly addictive possibly cause an overdose. Here's some examples. Alcohol, opioids such as heroin, methadone, codeine, morphine, barbiturates, benzodiazepines, antihistamines. All of those would fall into that category. Hallucinogens alter a person's perception of reality, a bit different than our uppers and downers. There's that other category. they often result in some sort of auditory and visual hallucinations, and that typically has a term, tripping. Now, although hallucinogens are generally less addictive than some of the other drug classifications we discussed, their immediate impacts are generally more severe. Now, this happens because of the way that they are broken down in the body. We can get into that on another topic. Check for another volume later. Some examples of hallucinogens are LSD, acid, magic mushrooms, PCP. Inhalants are chemicals that are primarily ingested by breathing them in. Most inhalants are commonly used as materials that are not designed to be ingested by humans. Most produce feelings of a high. While they tend to be less addictive than other substances, the use of inhalants is incredibly dangerous and can cause a lot of health problems. Example of commonly abused inhalants includes paint thinner, glue, and laughing gas. Now, what's the draw of some of these recreational drugs and other harmful substances? Well, let's discuss some of the ones that are popular and that we all know very well, and we'll break them down by volume, and we'll see what they do in the human body, why they are dangerous, and how we in EMS can provide pre-hospital care. If I were to ask you, what drug do you think is the most used in America? What would you say? If you guessed marijuana, you'd be absolutely right. If you, like me, live in a state where marijuana use is still illegal, then this does still count as an illicit drug. Why don't we discuss exactly what marijuana is and what it does? Marijuana is known by other names like weed, pot, grass, bud, or Mary Jane. It's a green mixture of the dried flowers of cannabis. Marijuana is versatile in that it can be consumed multiple ways. And one of the most common ways is smoking it, which is known as a joint. Now, if someone has a joint, this would be a hand-rolled cigarette, and basically the marijuana would be an additive in it. Another popular form is a water pipe known as a bong. Very common. A lot of times can even be done in social settings. Or there's another form, blunts, which are marijuana that would be wrapped with cigar wraps. Marijuana also can be used in tea, food, brownies, cookies, candies, and we refer to any of these substances by a nickname. We call those edibles. Now, marijuana can also be vaporized via vape pens or pods that are used to inhale marijuana. These all items, whether it be cigar wraps, whether it be pens, any item, bongs even, that a person could need, are found oftentimes at a local gas station or two. Now, stronger forms of marijuana, those actually come from the tended female plants, and concentrated high doses of marijuana's active ingredients like hash oil or butter. Those are the stronger versions. What is the allure here? Well, remember, most drugs, there is some sort of high. It can be an upper high and it can be a downer high, but usually, most of the time, people are looking for a high. And that high that people are seeking when it comes to marijuana, that comes from a chemical, and that chemical is known as delta-9 or THC, which is produced by the leaves and buds of the female cannabis plant. Depending on how much of this THC is found via nicotine or other edibles, means that it can be sold, even in places where there's not a law there yet. But keep in mind, the cannabis plant contains more than 500 chemicals, wow, including more than 100 compounds that are chemically related to THC. Wow. Similar in structure, and we call those cannabinoids. One that is becoming very, very popular, you could walk in any known grocery store or any known convenience store and possibly find this. I jokingly call this particular cannabinoid marijuana's sober cousin, which is CBD, cannabidiol. Interestingly enough, everyone's high is different. Doesn't matter how the consummation happens. Doesn't matter which plant you are working with. Highs hit differently. And this will be an important point later when we talk about treatment modalities and certain psych conditions. But remember, because the high is different, that is typically due to some sensitivities because there are other substances on board. But here's some basic timelines, at least, for when the high hits based off of consumption route. Smoking and vaping, usually a 20 to 30 minutes to activate the high. And this form is particularly interesting because the nose and the mouth are the first to interact with the cannabis. Even the smell can affect someone. Mucosal lining gets involved, and immediately there starts to be somewhat of an effect. There have even been studies and talks about throat and mouth issues that have came from this. Now, once that THC has crossed the blood-brain barrier, it binds to your CB1 receptors, and the high is initiated. And THC is pretty potent because of the activation that can occur within seconds. Now, those receptors that we talked about earlier, CB1, they're not just made to only be activated by cannabis. I love to think about neurons like a cell phone notification. But there is a special neurotransmitter that cannabis does indeed act on in particular. And that special neurotransmitter is known as anandamide. So those receptors get activated by the neurotransmitters, and they constantly receive messages from anandamide. Anandamide, which sounds like a wonderful word, is actually from the Sanskrit word for bliss or molecule, happiness, mental balance. The root word for anandamide comes from that Sanskrit word also for happiness, pleasure, joy, or inner bliss. That anandamide is also found in chocolate. Similar reactions to the two. But back to the chocolate, I mean the activation process. THC then concentrates in the bloodstream, and the high develops and effects like creativity, relaxation, or pain relief occur. Besides THC interacting with receptors in the brain, it also interacts with the spinal cord and peripheral nerves. There are groups of target receptors for THC that are abundantly present in the cerebellum, basal ganglia, cerebral cortex, and the hippocampus. And these target sites explain why THC causes many effects that are seen when someone is indeed high. The ataxia, inhibition, and analgesia. It also can be used in the medical field for some of these effects, and we will mention that as we go. We'll get into that. So we talked earlier about the legality, and in some states marijuana is legal, and in some states it's not. So with all of these useful effects, why is marijuana illegal? Let's take a little trip. Let's go back down memory lane and find out how marijuana started to get such a bad reputation and where the legalities come into play. You have to go way back at the turn of the century, actually. So there are, indeed, like we mentioned, medical benefits, but attitudes begin to shift towards cannabis. And this was motivated by the Mexican immigration to the United States. And this would have been time of the Mexican Revolution around 1910. There's actually a quote from a book. The book's name is Reefer Madness. And it says, "The prejudice and fears that greeted these peasant immigrants also extended to their traditional means of intoxication, smoking marijuana." Slusher wrote for The Atlantic that police officers in Texas claimed that marijuana incited violent crimes, aroused a wild lust for blood, and gave users superhuman strength. Rumors began to spread that Mexicans were distributing what was known as a killer weed to unsuspecting school children. People were terrified. Now, I'm not sure if you personally have seen someone who may have smoked marijuana, but the vast majority of people who do have little desire to fight. Actually, research has shown that alcohol is way more likely to process an aggressive behavior subtype than marijuana. In addition, cannabis, it also doesn't cause superhuman strength, but unfortunately, the stereotype, it stuck, and for some time, and the stigma just now is being lifted. But back to the original topic. Are there any dangers to marijuana? Well, obviously, like one would imagine, marijuana strictly is not recommended when brain development is occurring. Developing brains like those found in babies and children, and actually teenagers, the whole pediatric population, they are very susceptible to the effects of marijuana. It's also not recommended to be used by mothers during pregnancy. Now, here's a question that gets asked quite a bit. Has anyone ever died from smoking marijuana? Well, we're going to talk about some case studies that are definitely worth considering. And one of them being a teenager in 2018 who died of dehydration. But the root cause was a condition known as cannabinoid hyperemesis syndrome. Now, his mother tells the story in detail, which I will list here. Wonderful story, definitely worth reading. And here are some cliff notes. So this young man was not a daily smoker, but he had been smoking marijuana on and off for about 3 years before his symptoms started. He began to see a gastroenterologist, and he was starting to experience symptoms like GI upset, and because of all these things, he quit smoking. But in April 2018, and Brian would have been 17 at the time, he was living with his father. His father called his mother for transport to the emergency room because he'd been vomiting for about 3 days. When his mother picked him up in order to be transported to the emergency room, he vomited 5 times on the way to the ER. Things escalated from there. During his ER registration, he began to complain of numbness and tingling, began to have more intense vomiting. His muscles began to contract, and he exhibited signs and symptoms of a seizure or a stroke. Then lab results came back, and some light was shined on the topic. He was in kidney failure. So he followed up with a pediatrician, continued a cycle of what would be kidney failure rehydration and reversal. In a matter of months, he lost 40 pounds. Now, he quit smoking in some time, and he began to go to courses at a stress center for depression, things that we mentioned in the onset. A few weeks later, after these attempts, unfortunately, he coded at his home. Despite efforts, he was pronounced dead. The autopsy report said the cause of death was due to dehydration, and that was secondary to cannabinoid hyperemesis syndrome. And it's actually a fairly common phenomenon, actually. Most people are familiar with it because it's the reason why when somebody has ingested marijuana, they tend to want to do something known as taking a shower to sober up. Oftentimes, this is because it helps to decrease the effects of this syndrome. The ideology of how nausea and vomiting happens without marijuana is the same, which, brief review, we know that the brainstem gets activated, leading to a vasal stimulation, and neuroendocrine mediated processes start to produce salivation, stomach upsets begin, you really start to feel bad. After that, then the physical effects like the closure of the glottis to protect a person's airway from aspiration, and the relaxation of the stomach sphincters and retroperistalsis of the small intestinal contents to the stomach. And then we have the contraction, and that is of the stomach and abdominal walls. What happens next? Vomit is propelled from the mouth and into the environment. There is a variety of receptors that run along the multiple neurologic and endocrine pathways, which makes marijuana have a very special ability to be a either pro or an anti-mimetic. The cannabinoid receptors CB1 and CB2 that are present in the brain are also present in the hypothalamus, hippocampus, cerebellum, scattered throughout the parasympathetic nervous system, including the vagus nerve. And this is what leads us to cannabis having such a potent effect on the large swath of bodily processes, one of them being vomit. So things could go either way because of the numerous receptors that cannabis can act on. The neurologic and gastrointestinal organ systems to mediate vomiting sometimes have a paradoxical effect. Marijuana can be medically prescribed as an antiemetic for a variety of conditions known multiple sclerosis and chemotherapy, and patients do report this substance helping them very much. And scientists will admit the effects of marijuana in the GI system, it's a mystery. But what it would appear when we discuss with cannabinoid hyperemesis syndrome is there is a chronic overstimulation of the endocannabinoid receptors that disrupt the intrinsic control of nausea and vomiting. So it really depends. It's a toss-up. Some people, anti-nausea. Other people, causes the intense nausea and vomiting. But let's go back to some more cases of deaths from marijuana. In 2019, a 39-year-old woman in Louisiana, THC was stated as the cause of her death because the autopsy showed no other physical disease, pathologies, or afflictions. There was nothing else identifiable in the toxicological report. No other drugs, no alcohol. So oftentimes, it seems that this instance is debated. One professor says that the level of THCs in that woman's system at the time of her death were not sufficient to cause a fatal dose. But in the past, it has been estimated that an individual would have to smoke 2,000 joints to ingest a lethal amount of THC. And that's an estimate. The professor described the levels of THC in the woman's system as not that high. So again, a toss-up. No actual definitive answers there. So another instance happened with two poison control doctors from Colorado who saw an 11-month-old baby boy that died of an overdose of marijuana. Now, this report has ignited a lot of talk, The child showed up at the Colorado hospital in 2015. He was barely conscious because he had a seizure. The child was intubated in the emergency room, but unfortunately his heart began to fail. Now, on the death certificate, the baby boy died, according to the autopsy report, of myocarditis, which is the inflammation of the heart muscle. In children, this is oftentimes caused by a virus that reaches the heart muscle. But the doctors, they did all of the infectious disease panels and they said there was no viral infection involved. So, like with the other case, not any other factors, so highly debated and honestly, a toss-up. Could be not. So, now, obviously, marijuana, like alcohol or lack of sleep, can severely impair a person's judgment. So, death from trauma of the influence of marijuana has been clearly documented because there's multiple cases of it. There was a study in Canada that revealed in a marijuana-involved accident, nearly 90% of the victims arrived by ambulance. And when no alcohol or cannabis was involved, the number of people that required an ambulance dropped to 40%. Now, in addition to that, 50% of marijuana users in a car accident required hospital admission compared to just 6% of those who did not. In this case, it would be considered a recreational drug. No regulation at this point. One would think common sense would tell you not to do anything dangerous, be careful of driving, be aware of your surroundings. But as human history has demonstrated, if common sense was so common, why don't more people have it? So there is a chance of dying, and it's very slim. Marginal, honestly. Trying to say that smoking marijuana is a sole cause of death, it's fairly slim. However, like anything else, from a gunshot wound to a spider bite, there can be troublesome side effects. Let's talk more about marijuana in the light of emergency medicine. In 2014, Colorado was one of the first states to legalize cannabis for recreational use. And since then, it has been noted that there is a rise in emergency room visits. And this is due to secondary complications of marijuana use. There is a theory that before the legalization, people experiencing signs and symptoms may have not visited the emergency room because of legal concerns, naturally. However, it has been clearly documented that physical bodily injury was a leading cause of emergency room visits and hospitalization among cannabis users. There is a clear and direct link between bodily injuries and the consumption of edibles. There was a college student in Denver who jumped to his death from a hotel balcony after eating more than 6 times the recommended amount of a marijuana cookie. In this case, it was reported that it was likely this was the first time this 19-year-old had ever used marijuana. That, coupled with the amount he ate, caused psychosis, and this led to a terrible injury. Now, there is another case where a man killed his wife and claimed that it was due to an overdose of edibles. This caused him to act violently, and unfortunately, a terrible tragedy ensued. From this particular person, the man who killed his wife, I'm going to read a direct quote. He said, "There is absolutely no other situation I can think of where I would do that. For me, I know it's 100% marijuana, me ingesting it, and that is the reason why I did it. I didn't even know it was her." And this was said by the man, Richard Kirk, who was convicted of second-degree murder for killing his wife. There's another case of a young man who died by suicide at a Colorado ski resort after ingesting high doses of edibles. How do some of these traumatic injuries happen? Well, remember, highs hit differently for different people. And also remember the consumption times. So sometimes when these are off and when these have possibly too much of either a consumption or time, that can be an issue. And that is where some of these traumatic injuries occur, because acute psychosis can occur, and that's a problem. Marijuana smokers have also requested transport due to metabolic issues. It's been found that there's higher levels of blood and urine levels due to smoke-related toxins. And there's one in particular, and that one's associated with anemia, liver, and neurological damage. Another common emergency room visit is that teenagers are starting to be seen for wheezing or whistling in the chest after vaping marijuana. And now, can this happen with other types of nicotine that is vaped? Absolutely. But it has been noted that there is a higher rise with marijuana. Now, this is basically due to a respiratory irritation, and similar to nicotine use. Now, one important pre-hospital presentation that providers can see with cannabinoid hyperemesis, besides the common cyclic episodes of nausea and vomiting, is a dysregulation of temperature and perception and abdominal pain. And these symptoms are more seen with long-term marijuana users. It's been noted that repeated uses dull this effect in the digestive tract. And the opposite occurs, which is where this hyperemesis comes from. This GI upset is something that all healthcare providers need to be concerned about. And airway control is something that all healthcare providers should be concerned. Let's discuss another drug, but it is still somewhat in the marijuana family, and this one in particular is definitely worth providers' consideration. We're talking synthetic marijuana. Some other names for this is Spice, K2, or Katie. These designer drugs are intended to mimic THC, and they're sold under the guise of herbal incense or potpourri. And they're attractive looking in different sorts of colors and different sorts of packages, unfortunately. Now, there has been noted abuse that has been occurring due to psychoactive properties and lack of information regarding health and safety risk. So the idea of spraying or mixing synthetic cannabinoids on plant material, that's the vehicle. And this is the common route of administration. In addition to the cannabinoids laced on plant material and sold as potpourri and incense, liquid cannabinoids have been designed to be vaporized through these disposable and reusable electronic cigarettes, e-cigs. Now, here is, again, meat and potatoes. Here's what we gotta remember. These synthetic compounds bind to the same receptor in the body and the brain as a THC. But there's a problem here. The structures differ greatly. In fact, another trip down memory lane, a little history. The first synthetic cannabinoids were actually produced legitimately as tools for investigation. And the idea was to investigate the pharmacology of the new mixture. Now, the active ingredient in K2 can be more potent and dangerous than THC. Those ingredients is what produces an intense effect and carries a higher risk of toxicity and overdose. So when we look at the ingredients in K2, they are pyrethroids. Pyrethroids are pesticides that were invented in the 70s, and they're used in crop protection, forestry, wood, textile industries, and some people even use it in their homes. But they're used in medicine and in veterinary medicine to treat parasitic infestations. Pyrethroids are recommended for protection against malaria and Zika by the World Health Organization. But let's talk about their mechanism of action. Pyrethroids act on voltage-gated sodium channels. Now, this causes an influx of sodium ions into nerve cells and permanent depolarization again and again. Now, this influences the activities of enzymes, especially enzymes that happen in the nerve and the liver cells. So, in small, regulated amounts, it's a relatively safe compound. However, there are animal studies that have shown exposure to this chemical can increase adrenaline very quickly. And it's alarming in the increase, and that is what we call the bad batch. The bad batch is a common street term, if you will, and that phrase is used in public safety, emergency medicine. And what that phrase means, bad batch, is that there's an uptake in overdoses or fatalities. Now, they have to be linked to a specific drug. Let me give you some cases, and this will make sense. In the Austin Travis County EMS in Texas, they reported a deluge of overdose calls. The normal overdose rate for this area is 2, from 9 a.m. to 8 p.m. There were 30 suspected overdoses in one day between those times. And between all those overdoses, there were 4 deaths and 3 were called at scene. Now, these 911 calls, they did come from a variety of neighborhoods, businesses, public areas, and there were a vast majority of ages and demographics. But more than likely, they were all tied to the same source. And this is due to a very interesting observation. It's due to the fact that despite race, age, location, or comorbidities, the symptoms all have the same signature. And the bad batch, this occurs with the synthetic marijuana. This is pretty common. Take, for instance, the state of Illinois. Between the dates of 2018 and 3 months. In 3 months, there were 164 people who reported illness from synthetic cannabinoids. And these were laced with rodenticides. Now, the Illinois Department of Public Health has reported 4 deaths in connection with the use of synthetic cannabinoids. Most of these were chemicals that were sprayed on dry plant material. And an especially noteworthy detail, they were sold at convenience stores, over the counter in gas stations, and an attractive or flashy, interesting packaging. There's a chilling report that came from the state of Illinois, along with Michigan, and health officials were starting to warn the public about a specific version of synthetic marijuana that's laced with rat poison. Now, that causes uncontrolled bleeding in hundreds of people, and it killed others who ingested the tainted products. The synthetic cannabinoid was sold under the names as Spice or K2, hospitalized so many people. And then there was a particular patient stamp that they noticed in Illinois. People in hospital emergency rooms had severe bleeding because they had ingested the synthetic marijuana. So Illinois in particular discovered something chilling in the emergency department. people were coming into the emergency room that had ingested synthetic marijuana that was laced with brodicaform. One in particular was a patient who was just prescribed and regulated by dose of medical marijuana, who unfortunately ran out, needed something quick. So unfortunately, this patient did try this type of spice, and it was laced with brodicaform. That patient then experienced blood pouring from the mouth, from the nose. Terrifying. Needed a whole platelet transfusion due to this reaction. What exactly is brodicaform? There is a doctor, and I'd like to quote him directly. A superwarfarin is what this is. It interferes with the production of vitamin K dependent coagulation factors. This lethal anticoagulant is found in rat poison. In fact, warfarin, that anticoagulant that most people are pretty aware of, it was actually first used for rat poison. Another bad batch of synthetic marijuana appeared to be circulating in Washington, D.C., where crews suspect the substance was rampant in 210 cases. And in these cases, severe nosebleed, vomiting, people collapsing. Of those cases, 150 people were sent to hospitals, 3 people died, and more than 100 have been sickened taking these synthetic cannabinoids. These human-made compounds, problem with them is they do target the same brain receptors as marijuana. And so similar signs and symptoms were observed at poison centers. And then Maryland. So the state of Maryland, had symptoms like unexplained bruising, coughing blood, bleeding from the nose, gums, blood and urine and feces, and excessive heavy menstruation, reported in conjunction with synthetic marijuana. This, in particular, awful cases. A lot of those patients were already sick or having multiple comorbidities, polypharmacy, and now the horrible effect of this massive bleeding. Terrible. An ongoing investigation identified that the culprit was found in blood. And that culprit was the same rat poison that was sold from hardware stores. It was causing brain damage even. Why add such a terrible thing? What is the purpose of adding this synthetic? Well, there's some reasons. Drug makers include ingredients for bulking up cost and for cutting costs and bulking up products that have a cheaper non-active ingredient. And the idea is to achieve particular effects by adding other drugs to mask poor product quality. That's to compensate for the poor effects that are initiated by this. And bear with me, this one is rough. Drug users deliberately were ingesting rat poison. And the idea with this is so drug dealers could have them stay high longer while taking marijuana. And actually this happened as well with cocaine. The toxin ties up liver enzymes that try to metabolize drugs, and it extends the effects. This can go on for some time. Another concern regarding synthetic marijuana is use of this K2 and spice in correctional institutions. Prisons are now finding that K2 is the new drug of choice. It's been reported in several areas, mine included as well. It's now the 3rd most popular contraband after homemade alcohol and cigarettes. So what has happened? Paper mail, letters, cards, books, anything paper is one of the most common smuggling routes for synthetic marijuana in facilities. So, changes have been made to mail policies, like prohibiting book deliveries, only postcard policy, and providing only scans and copies to inmates rather than originals. Now, some of these policies have been challenged in court and have not been approved, rejected. This is an important consideration for EMS because when a patient is transported from a correctional institution due to a medical emergency, it could be due to this spice or K2 that is possibly on board. It's a good idea to consider, was a synthetic used? Unfortunately, this lace type of substance, it's hard to avoid, even for correctional officers. So now with all of this talk of wacky weed, aka marijuana, that's laced with some products that indeed it should not be laced with, bad ingredients like rat poison and fentanyl that we've discussed, what is there good about marijuana? Or is there anything good that can actually come out of using marijuana? If there is one gem that I hope that everyone takes away from this video, it's this. I'm going to ask for your attention here. Marijuana has a long-standing history as being a medicine, and really an all-around pretty versatile tool. Hemp actually was used as paper for quite some time, and it was a mixture for just about everything, from drafts of the Declaration of Independence to drafts of the Constitution. So let's take another long trip down memory lane, and this trip, it's going to be a tad longer than the trip we took earlier. We're not going down the street. This is going to be a long venture, actually, down memory lane into some history. And this history is going to be very interesting because this is going to be the history into cannabis and its role in healing. Because from ancient times, cannabis has been used in healing for all kinds of ailments. And believe it or not, it still follows a similar pattern today. Let's start with India. And we're going to mark this about 1000 BC. The Vedas, which sacred texts written in Sanskrit, say that cannabis is one of the 5 sacred plants. And those 5 sacred plants release humans from anxiety. And there's a reason for this. It's mentioned that it's a source of happiness, and this is the key, liberation. And the idea is for an individual to attain a heightened state of consciousness. And this heightened state of consciousness is for a reason. Because by consuming this cannabis, this heightened state of consciousness, a human can equal what the Indians felt was a deity, Shiva. And they could connect with that divine being. So for the Indians in 1000 BC, they used cannabis for worship. And the similar reactions or feelings that they had, it's basically the same in the onset. They felt heightened concentration. Now, the reactions that the Indians were looking for, it's very similar to some of the feelings that people experience today when smoking marijuana. The feelings of increased creativity, heightened levels of thought, increased openness. All of those are very similar to what the Indians would have been looking for. Also, there has been noted to be in food and drink leaves of the cannabis plant. And this was interesting because this actually was part of a ritual. They would ritually consume these during a spring festival. Now, during these spring festivals, the thought again was to consume these for worship. So, back in 1000 BCE, edibles were invented. I'd like to read a direct quote from Joy King, and here is a link to that. Very, very interesting article. And if you have time to read it, it really is an excellent read. But this quote says, cannabis, ancient history of ritual use, was discovered in pharmacological cults around the world. Old tombs in Western China were the earliest evidence of back use of cannabis. Smoking was found in old tombs in the Panamera Mountains in Western China. Cannabis residue was discovered in burners with burnt stones, probably used during a funeral or ceremonial rituals. End of quote. Imagine that. At the very end of a funeral, what better way to say goodbye than to smoke marijuana? Now, there is a common thread to consider. And for this trip down memory lane, this history discussion, this same common thread will become very important. Cannabis has been used for a common purpose to treat pain. And that's going to come into play, especially when we talk extensively in our day about medical marijuana. But for now, before we zoom forward in time, keep this key point in mind. Marijuana and the central nervous system, they really do have a linked connection, especially when it comes with pain. We spoke earlier about the effects of the basal ganglia, the cerebellum. All of this comes into play when it comes into marijuana, the treatment of chronic pain, and our pain perception. Now, in the 1800s, it's very interesting. The focus of marijuana, it started to shift and things were geared towards women. It can sometimes be a misconception that marijuana is oftentimes favored by males. But in ancient societies, women played a pretty significant role as being the herb gatherers and the healers. And they were looking for something in particular, cannabis. And the idea for that is cannabis as medicine. Early civilizations document that women would gather cannabis for rheumatoid, gout, malaria, pain relief. This was all part of that hunting and gathering that women did. Now, there is an Egyptian collection of medical texts from 1550 BCE, and it mentions the use of cannabis for vaginal inflammation. Physical evidence from the 4th century also points to the use of cannabis for easing childbirth. And the use of cannabis began to spread from the eastern regions to the western regions. And they started to gain popularity and really become a sensation for the use of uterine hemorrhage, for menorrhagia, dysmenorrhagia, and gonorrhea. And also to increase labor contractions. In fact, it has been noted that Queen Victoria was known to receive doses of cannabis for menstrual pain. This would have been at a time where social norms would have been at an all-time high, but whatever worked. Now, in the 7th century, cannabis was noted to be extremely helpful when it came to pain. Again, in particular, it was noted and studied with menstrual disorders, the pain associated with cramps, childbirth, anal fissures, migraines, postpartum hemorrhage, lactation, breast swelling, and intense pain. And what most of those had in common is that cannabis helped with visceral pain. So in the 1900s, things start to kind of change. Treatment started to work to counteract these painful cramps. And again, it gets observed the particular influence over visceral pain. And here's where members of the medical community start to come into play. Some of those members considered that cannabis should have been deemed a narcotic and that it needed to be regulated. Because at this time, America was actively using marijuana for quite a bit. Insomnia, inflammation, migraines, stomach aches. And at this time, there was no regulation. So marijuana was legal, so was heroin, so was cocaine. Let the imagination run. Anything and everything went. So then something gets enacted. Something known as the Pure Food and Drug Act. And the implementation behind this began under the direction of Theodore Roosevelt. And this would have been on June 30th, 1906. And this did something very important. It started to ensure that accurate labeling would happen. And the goal here was to improve health, safety of food, and also education. So, just like today, we would have an idea, good foods, bad foods, what we were consuming. But, as with all things, with all organizations, there are rules and there are boundaries. So, this indeed led to prohibitions. In cannabis, it was classified as a drug that required special labeling. Now, in 1914, something known as the Harrison Act was enacted, which declared drug use a crime. And to be quite frank with you, and quite frankly, it said, pay up. And the idea was to pay for using drugs illegally. And here's something very interesting. A hefty tax was placed on prescription drugs. It also allowed for federal regulations. And this got a very important ball rolling. So next came an important act known as the Volstead Act in 1919. This became enforced, and then in 1920, this prohibited the manufacturing of alcohol. Prohibition began. Now, go back a little bit. Let's discuss an important time period of social change. And this would have been in 1907. This is when the Poison Act becomes in force. This is in California. Notice what exactly this act states. It says that cannabis is a poison. And at this time, cannabis is now starting to get feared amongst people. Did you notice what time period this was in? 1907. Think back to the earlier onset of this video. Do you remember what else happened at 1900s, early time? Remember the killer weed impression, right? It's the same time period. And that impression, it did not help with the already spread fear that had begun. It only got worse. So, in 1911, Massachusetts, first state, it decided to prohibit marijuana. It was then followed by New York, Maine, Wyoming, Texas, before 1920. Now, in the 1930s, by then, the U.S. Federal Bureau of Narcotics started to warn of the increasing abuse of cannabis. And then, by 1937, 23 states had started to criminalize possession. In 1942, marijuana was removed from the U.S. pharmacopoeia. In 1956, cannabis was included in the Federal Narcotics Control Act, leading to more strict federal penalties for its possession. And in the Controlled Substance Act of 1970, the federal government decided to connect with the DEA, and they decided to now classify and categorize marijuana. Remember, we talked about some of our schedules in our classes. They decided Schedule 1, that substance meaning no accepted medical use, and it was among the class of drugs having the highest potential for misuse and or abuse. So, remember we said earlier, marijuana, it's used oftentimes in pain, right? So, during this time period of marijuana being banned, I would like to bring to attention two very important cases of people who decided to be patient advocates and utilize medical marijuana before medical marijuana was being used in the medical community, if you will. And one of them being Mary Jane Rathbun, who obtained the nickname Brownie Mary. Brownie Mary baked nearly 600 cannabis-infused brownies a day for the San Francisco General Hospital. This wonderful woman, Brownie Mary, baked nearly 600 cannabis-infused brownies a day for the San Francisco General Hospital AIDS ward. She eased the suffering for countless individuals that were experiencing what's known as wasting syndrome. Let me give you background on wasting syndrome. This is a process of extreme inflammation due to excess cytokines. And this happens due to some sort of chronic fatal condition. Happens in cancer, AIDS, something along those lines. Now, these excess cytokines, these are proteins that are in your immune system, and they manage how and when your immune cells react to these viruses. Cytokines itself, it's a word that comes from the Greek word that basically mean bad body or poor physical state. It's very sad to see. Now, according to the Cleveland Clinic, these extra cytokines, they cause inflammation that makes you lose fat and muscle. And at this end of life state, that pain, it should be managed. The Brownie Queen's advocacy paved the way for legalization. The second group of warriors I'd like to bring attention to happened in 1975. Robert Carl Randall and his wife Alice O'Leary Randall were arrested for cannabis cultivation after discovering the plant's benefits for Robert's glaucoma. Together, they fought conviction, and Robert became the first individual to gain legal access to medical cannabis in 1976. And to this day, Alice is still a pioneer in the medical marijuana medicine field. That led the way to 1996. California was the first state to pass the medical marijuana law that removed state penalties for patients using marijuana for specified medical conditions. Now, numerous other states have since passed similar legislation. Let's talk about medical marijuana as a medication today and how it's used. It is going to be very important for pre-hospital providers to understand why exactly it is starting to be prescribed. The most common use for medical marijuana in the United States right now, just as it was back then, is due to pain control. And this is usually due to some sort of chronic pain disorder. Marijuana indeed is not a narcotic, and we should make sure we specify here as well that this is not strong enough to treat severe pain. So it's going to be inappropriate for a broken bone or something to use pre-post surgery. It's not what we're using it for. But what it is excellent for, and it is really starting to change lives, is for chronic pain. So chronic pain is starting to really become in itself in America a serious concern. A study from the National Institutes of Health shows that new cases of chronic pain occur more often among U.S. adults than new cases of several other common conditions. Why is medical marijuana being prescribed for some of these conditions? Some of these chronic pain conditions that we discussed? Well, for one reason in particular, think age groups. What are the dangers of opioids in elderly? What might medical marijuana have over an opioid for an elderly patient? Well, let's do a quick review. Renal insufficiency along with liver insufficiency in older adults reduces renal clearance of opioids, which may lead to drug accumulation, causing neurotoxicity, impaired metabolism, or our worst nightmare, respiratory depression.
Stinky.
Also, comorbidities like COPD, altered absorption in the gastrointestinal tract due to lack of composition, causes issues with unpredictable metabolism and possible reactions. If our buffer systems do not work and we decide to possibly impede the central nervous system, that could be a problem. Take, for instance, morphine in particular. In the setting of significant renal impairment, it causes a significant and severe risk of seizures. What about liver failure? Well, most opioids are metabolized in the liver, and the risk of adverse effects, it's high. According to an article produced from the Mayo Clinic, and it is an in-depth article for elderly patients and opioids, I would highly suggest any provider to review these topics. But it said, on average, the typical nursing home patient takes a daily maintenance of 7 medications every single day. Now, if you are a pre-hospital provider or a nurse and you pick up a patient that comes from the skilled nursing facility, if you notice in what we commonly refer to as a MAR, or basically a patient's list of medications that either they take daily or a list of medications that they have on hand as needed per physician's orders. One of those medications a lot of times are naloxone. Why is that? Because oftentimes there are what we know as polypharmacy. There is a mixture of multiple medications on board. Take, for instance, one that is a particularly scary combination of benzodiazepines and opioids that is particularly deadly in actually all patient groups. For the CDC, the guideline is specifically cautioned against putting those two medications together. Reason being, the depression that medications cause possible accidental overdose. Again, why so many of our elderly patients are prescribed Narcan, naloxone, because of this accidental overdose. That risk factor can sometimes be there on some of the lightest of narcotics. So again, in patients with these comorbidities, and let me make sure I list some of them in particular: obesity, hypoventilation, obstructive sleep disorder, sleep apnea, encephalopathy, chronic obstructive pulmonary disease, all of these possible risks. Sometimes opioids may not be the best options. However, we still have an elderly patient who's in pain, and medical marijuana is starting to be considered. Reason being is because the safety of these medications. There is a considerable low risk of overdose in comparison to a narcotic. Also, there is a lower respiratory depression risk in consideration of cannabis toxicity. Also, not to mention, a far less addictive substance. And on another light, it also can take the place of NSAIDs like Advil or Aleve for people who can't take them due to problems with their kidneys, ulcers, GERD, or people who, again, due to age, are having a slowdown of the gastrointestinal system. Also, remember earlier we were discussing what kind of pain medical marijuana targets? Well, it's appeared that it also can treat the pain of multiple sclerosis. And it's also been spoken of to treat nerve pain, which is an alternative to Neurontin, Lyrica, and even gabapentin in some patients. There has started to become other reports to surface, one of them being that medical marijuana is allowing patients to have not only a better quality of life due to a reduction of chronic pain, but also due to a patient being able to return to their daily activities without excessive brain fog that a patient would receive from a narcotic. Oftentimes, if a patient is in chronic pain, they will need some sort of a narcotic regulation, rather this be from a physician that specializes in this. Those long regimens of pain medications, those can cause a lot of fatigue and brain fog. It's a lot on a patient. It has been noted that medical marijuana is not causing some of those effects, oddly enough.
Interesting.
Patients are reporting that they're able to resume some of their previous activities without feeling completely drained or washed. Some of that lethargy is gone. Here's another reported effect: muscle relaxation. And that is key in one condition in particular: Parkinson's disease. Patients are reporting a reduce in tremors. Harvard Health has done extensive studies on cannabis and how it is affecting patients. Some of the other conditions that they've reported on that medical marijuana has been found to treat and be successful for patients is fibromyalgia, endometriosis, interstitial cystitis, irritable bowel syndrome, Crohn's disease, and some other conditions where the final common pathway is chronic pain. As someone who has struggled with endometriosis for years, to have the burden of not dealing with chronic pain and being able to live a normal life, definitely worth a consideration. Also, it has been known to, as we discussed earlier, in patients that it works nausea, and in particular, weight loss, patients with anorexia. And it can be used to treat glaucoma, as we discussed as well. A highly promising area of research is our patients with PTSD and a particularly vulnerable and important group, veterans, especially newly researched veterans who are returning from combat zones. Now, at this time, just to make sure we emphasize, in case anyone needs to have this clarified, right now this video has been made in 2024, and legalization, when a state says that marijuana, cannabis, is legal, full legalization means that there are no prohibitions whatsoever. So that means possession and use for recreation, any purpose whatsoever, is accepted. And so far, in 11 states, that has happened: Colorado, Washington, Alaska, Oregon, California, Maine, Massachusetts, Nevada, Michigan, Vermont, Illinois, and the District of Columbia. Alternatively, several states have decriminalized cannabis, meaning it remains illegal, but individuals possessing less than a specified amount are not prosecuted by the legal system. Now today, that is 26 states that have decriminalized small amounts for personal consumption. Now, with that being said, in some of those states, they have also allowed for those small amounts to be sold in stores. Now, we have discussed some of the dangers, but obviously, most of those dangers are marginal. So why should pre-hospital providers be aware if there isn't a large population risk that has died from marijuana? For the common paramedic or EMT hospital provider, we tend to be concerned with the top deadliest pathologies: cardiac conditions, ACS, stroke, respiratory conditions, or cancer. Those top pathologies kill millions every year. Diabetics, we train hard, we study repetitively, do continuing education, right? Thumbs up. And we learn to properly treat these conditions. But marijuana, is it just weed? Well, here is a key point. Again, if you will take this point with you. Too much of anything can be a bad thing. Too much medicine can be a bad thing, even oxygen. Remember that. This is why regulation comes into play, and it's really important. Reason being, to ensure a safe amount is being consumed. So that's volume 1. That was a lot. That sea was deep.
Wow.
Shall we review? The term drug can be used interchangeably, but the word medicine can't. The main goal of medicine is what? Treating disease. Drugs can be used for pharmaceutical or recreational purposes. Contrast everything that we've just said about medicine with alcohol, or nicotine, or caffeine. Now, all of those are also considered drugs. Why? Well, because they are typically not prescribed in a regulated dose or monitored by a healthcare professional. These type of categories refer to how drugs impact the mind and the body. And here's a key point, in particular, the central nervous system. In short, downers are depressants and uppers are stimulants. The increase of energy, concentration, alertness. And in short, uppers are believed to provide a rush. Downers affect the central nervous system by just what it sounds like, a depressant. The functioning of the central nervous system slows, and feelings of relaxation occur, tiredness, oftentimes when one feels that they need an escape. This is the type of drug that could be preferred. Now, it's true. All of the resources and people of the DEA are dedicated to the mission of enforcing controlled substance laws. This is the main reason that they exist. And the common understanding that we all know, investigating criminals and gangs, illegal drug trafficking, it is the core of what they do. But for medical professionals, especially when we speak about some of these addictive substances, there's something else that the regulation by the DEA ensures, which is the manufacturing and distributing of controlled pharmaceuticals. And we do that by something known as scheduled or prescription drugs. And those scheduled drugs are listed via chemicals. And when we say scheduling, we talk about drugs, substances, chemicals that are used to make drugs. And we take all of those and we classify them into 5 distinct categories or schedules. And this depends on the drug's acceptable medical use. And here's something very important to remember. This is a big one here. It also depends on the drug abuse or dependency potential. Names like weed, pot, grass, bud, or Mary Jane. It's a green mixture of the dried flowers of cannabis. Marijuana is versatile in that it can be consumed multiple ways. And one of the most common ways is smoking it, which is known as a joint. Now, if someone has a joint, this would be a hand-rolled cigarette, and basically the marijuana would be an additive in it. Another popular form is a water pipe known as a bong. Very common. A lot of times can even be done in social settings. Or there's another form, blunts, which are marijuana that would be wrapped with cigar wraps. Marijuana also can be used in tea, food, brownies, cookies, candies, and we refer to any of these substances by a nickname. We call those edibles. So during this activation process, THC concentrates in the bloodstream and the high develops. And this has some pretty interesting effects: creativity, relaxation, and pain relief. Besides THC interacting with receptors in the brain, it also interacts with the spinal cord and peripheral nerves. There are groups of target receptors for THC that are abundantly present in the cerebellum, basal ganglia, cerebral cortex, and the hippocampus. And these target sites explain why THC causes many effects that are seen when someone is indeed high: the ataxia, inhibition, and analgesia. Besides THC interacting with receptors in the brain, it also interacts with the spinal cord and peripheral nerves. there is a special neurotransmitter that cannabis does indeed act on in particular. And that special neurotransmitter is known as anandamide. So those receptors get activated by the neurotransmitters, and they constantly receive messages from anandamide. Anandamide, which sounds like a wonderful word, is actually from the Sanskrit word for bliss or molecule, happiness, mental balance. The root word for anandamide comes from that Sanskrit word also for happiness, pleasure, joy, or inner bliss. And it's actually a fairly common phenomenon, actually. Most people are familiar with it because it's the reason why when somebody has ingested marijuana, they tend to want to do something known as taking a shower to sober up. Oftentimes, this is because it helps to decrease the effects of. There is a variety of receptors that run along the multiple neurologic and endocrine pathways, which makes marijuana have a very special ability to be a either pro or an anti-mimetic. The cannabinoid receptors CB1 and CB2 that are present in the brain are also present in the hypothalamus, hippocampus, cerebellum, scattered throughout the parasympathetic nervous system, including the vagus nerve. And this is what leads us to cannabis having such a potent effect on the large swath of bodily processes, one of them being vomit. So things could go either way because of the numerous receptors that cannabis can act on. The neurologic and gastrointestinal organ systems to mediate vomiting sometimes have a paradoxical effect. And scientists will admit the effects of marijuana and the GI system, it's a mystery. But what it would appear when we discuss with cannabinoid hyperemesis syndrome is there is a chronic overstimulation of the endocannabinoid receptors that disrupt the intrinsic control of nausea. There can be troublesome side effects. There is a theory that before the legalization, people experiencing signs and symptoms may have not visited the emergency room because of legal concerns, naturally. However, it has been clearly documented that physical bodily injury was a leading cause of emergency room visits and hospitalization among cannabis users. There is a clear and direct link between bodily injuries and the consumption of edibles. Of possibly too much of either a consumption or time, that can be an issue. And that is where some of these traumatic injuries occur because acute psychosis can occur. And that's a problem. Marijuana smokers have also requested transport due to metabolic issues. It's been found that there's higher levels of blood and urine levels due to smoke-related toxins. And there's one in particular, and that one's associated with anemia, liver, and neurological damage. Another common emergency room visit is that teenagers are starting to be seen for wheezing or whistling in the chest after vaping marijuana. Some other names for this is spice, K2, or Katie. These designer drugs are intended to mimic THC, and they're sold under the guise of herbal incense or potpourri. And they're attractive looking in different sorts of colors and different sorts of packages, unfortunately. There has been noted abuse that has been occurring due to psychoactive properties and lack of information regarding health and safety risk. So the idea of spraying or mixing synthetic cannabinoids on plant material, that's the vehicle. And this is the common route of administration. These synthetic compounds bind to the same receptor in the body and the brain as a THC. But there's a problem here. The structures differ greatly. The active ingredient in K2 can be more potent and dangerous than THC. Those ingredients is what produces an intense effect and carries a higher risk of toxicity and overdose. So when we look at the ingredients in K2, they are pyrethroids. Pyrethroids act on voltage-gated sodium channels. Now this causes an influx of sodium ions into nerve cells and permanent depolarization again and again. Now this influences the activities of enzymes, especially enzymes that happen in the nerve and the liver cells. So in small, regulated amounts, it's a relatively safe compound. However, there are animal studies that have shown exposure to this chemical can increase adrenaline very quickly. The Bad Batch is a common street term, if you will, and that phrase is used in public safety, emergency medicine. And what that phrase means, Bad Batch, is that there's an uptake in overdoses or fatalities. Now, they have to be linked to a specific drug that, despite race, age, location, or comorbidities, the symptoms all have the same signature. And the Bad Batch, this occurs with the synthetic marijuana. Users deliberately were ingesting rat poison. And the idea with this is so drug dealers could have them stay high longer while taking marijuana. And actually this happened as well with cocaine. The toxin ties up liver enzymes that try to metabolize drugs. Drug makers include ingredients for bulking up cost and for cutting costs and bulking up products that have a cheaper non-active ingredient. And the idea is to achieve particular effects by adding other drugs to mask poor product quality. That's to compensate for the poor effects that are initiated by this. Another concern regarding synthetic marijuana is use of this K2 and spice in correctional institutions. Prisons are now finding that K2 is the new drug of choice. It's been reported in several areas, mine included as well. It's now the third most popular contraband after homemade alcohol and cigarettes. So what has happened? Paper mail, letters, cards, books, anything paper is one of the most common smuggling routes for synthetic marijuana in facilities. So changes have been made to mail policies, like prohibiting book deliveries, only postcard policy, and providing only scans and copies to inmates rather than originals. Now, some of these policies have been challenged in court and have not been approved, rejected. This is an important consideration for EMS because when a patient is transported from a correctional institution due to a medical emergency, it could be due to this spice or K2 that is possibly on board. It's a good idea to consider, was a synthetic used? Unfortunately, this lace type of substance, it's hard to avoid, even for correction officers. Woohoo! I want to personally thank you for all for hanging in there. Let's see if we learned anything. Did we meet our objectives? I think so. One of them